Hypertrophic scar after Asian eyelid surgery. Will it flatten? It has been 5 months after my Asian eyelid surgery, and my scar is still lumpy and bumpy. The hypertrophic scar didn't disappear. I had steroid injection and silicone gel, but it's still lumpy and didn't flatten completely. I am worried that it will not flatten. Will it flatten? Any other treatment that will help my scar? Will PicoSure laser help?
Thank you for your question. You are 5 months out after Asian eyelid surgery, and with your eyes closed, you show an area of scarring that you refer to as a hypertrophic scar, and that you've undergone steroid injection as well as silicone sheet use. And you're asking, are there any other options? And you're asking also about the PicoSure laser. Well, I can certainly give you my perspective on a situation like yours. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I do specialize in Asian eyelid surgery amongst the other eyelid specialty areas that I do. And I can certainly share with you kind of an approach that I have as people are healing from this type of surgery. So first, it's important to understand that healing after eyelid surgery can take up to a year and even longer to really appreciate true surgical healing. So it's 5 months may be fine in terms of cosmetic appearance when your eyes are open and you can look pretty good. But as far as the scar is concerned, it is probably acceptable, certainly, that you underwent steroid injection, but there is still a lot of maturing and healing to go on. A lot of times, a scar like this, which doesn't look like it's that it's red or getting thicker and continuing to increase in size, will actually soften over time. Now there is, of course, this is being offered without a physical examination, but a lot of times just the normal blinking can actually soften these scars. Yes, a steroid injection can help, and depending on your surgeon's sense of appropriateness of the steroid injection, I think it's very, very important that you continue to follow your surgeon's guidance. The general approach has been, in my practice, is to be conservative and observe. It's extremely rare to have an undesirable thickened scar long term. It's almost, when you think about this type of surgery, the scar is in the place where the stitches were. And so what caused the scarring to occur? Well, basically, as you're transitioning towards the nose, the nasal skin, which is a little bit thicker, there could be some tendency for the scar to appear a little bit thicker. But generally, the other factors that contribute to a thickened scar, such as excess tension, are not really an issue with Asian eyelid surgery because you always have to leave enough skin to fold over. So, that being said, you have to kind of think to yourself, how does the scar look relative to the way it looked a month before? Does it look better? Does it look worse? And that's kind of what guides a physician as to what to do moving forward. As far as the question about laser type of procedure and whether it's a PicoSure or any other type of laser, you're probably thinking about whether a laser is appropriate in scar management. Basically, there are two important phases. Whether when it's early, when the scar has a lot of redness, that's where certain dye lasers or lasers that are attracted to red have some potential value. And then later, for scarring, a laser may have value in terms of planing down the scar or reducing it. I really don't think that laser has any role in this type of situation. I don't think it's going to be beneficial. You are creating essentially some type of a stimulation that can also result in more scarring. In my experience, again, this is the kind of situation where you observe, you allow for the full healing to occur. If the scar is still problematic, you can have a surgical revision or strategic injection of steroid when appropriate. And if there is any sign of the improvement occurring as the months go on, I think most of my colleagues would agree to just observe. So again, discuss this with your doctor. Try not to get confused with too many opinions from people who haven't examined you, but at least understand, hopefully from what I discussed, some of the thinking that goes into how a surgeon deals with this type of scar. So I hope that was helpful. I wish you the best of luck, and thank you for your question.